Hello, everyone, and welcome to Preemie Chats. This is a place for parents and healthcare professionals to gather, share stories, and learn from each other. I'm your host today, Jenna Morton. I'm preemie mom to twin boys who were born at 32 weeks and are now 11 years old. Preemie Chats is the creation of the Canadian Premature Babies Foundation, also known as CPBF. The Canadian Premature Babies Foundation is a parent-led charity that helps families during and after their NICU time through education, support, and advocacy. I invite you to take some time to visit our website. You can see it there on the screen, canadianpreemies.org. On the website, you'll find resources, you'll find links to our previous Preemie Chats, which we do every Friday. You'll find our podcast, all kinds of resources. But most importantly, you're going to find a community of parents and professionals who are working together to help our children thrive. Now, this is a parent-led initiative, and it's very much for parents as well as healthcare professionals. We would love to know which you are, where you're joining from. Please feel free to be part of the discussion today. You can let us know in the comments now where you're joining from, what brings you here. And throughout our presentation, feel free to leave your thoughts and your questions, as we will be able to have some time at the end to talk about your thoughts on today's topic. And today's topic is a very important one. I think it's going to be a really powerful presentation and discussion. We're going to look at how you can cultivate meaningful relationships with your healthcare providers while you're advocating for your preemie and your child. And my guest today to discuss this is Karen Taylor. Karen is a care coordinator with the Neurodevelopment Disorder Care Coordination Project at Alberta Children's Hospital. She has more than 20 years experience in nursing and healthcare, and she's been recognized as a family-centered care champion. Karen, welcome to Preemie Chats.
Hello, thank you, Jenna.
I am so looking forward to today's discussion. I think this is such an important topic for everyone who's on both sides of this discussion, as a parent, as a professional, and I know you've got special experience on both sides of this discussion to bring to this.
That's right, absolutely.
So I'm going to let you just kind of dive into your presentation and look forward to chatting with you a bit about it afterwards.
Okay, that sounds real good. Thanks, Jenna. Welcome, everyone, and thank you so much for taking time out of your day to share it with me today. I look forward to chatting with you a little bit about some of the professional experience that I have and some of the lived experience I have as well, and how those two things have come together to teach me some of the things that I'm going to talk to you about today. And so to start with, this is what it's all about: designing your roar with intention, the balance between relationships and advocacy. There's a picture of me almost 16 years ago. I am holding my son, who was just moments old. You know, that day that you become a parent, the word responsibility takes on a whole new meaning. You become responsible for your child's future and the life that they're going to lead along the way. I could never have imagined the enormity of that feeling until the moment I held my son for the first time. Lions roar to ward off intruders, protect their territory and their pride. Protecting your child becomes instinctual the moment that they are part of your life. And today I'm going to talk to you about how you can choose how your voice is heard, your roar. When my son, who I was just showing you that picture of, was in grade 3, I can remember my husband and I attending a winter concert that he and his classmates were performing at. And there they were up on stage, tapping wooden mallets together to the beat of the song that they were singing. My son, however, was shrugging his shoulders and rubbing his face and rubbing his hands together and not able to tap those mallets to the beat. That's because my son has Tourette syndrome. This is a neurological condition that causes people to have involuntary motor movements and verbal tics as well. So that's what was happening for my son. His tics took over and he was unable to stand on stage and do what his classmates were doing. Sitting and watching that was so hard, and all I wanted to do was go up, scoop him into my arms, and run away. When the performance was over, I noticed that his educational assistant came and put her arm around him and whispered in his ear. I couldn't hear what she was saying, but I knew that she was telling him that he had done a great job. The next day, I sent an email to that educational assistant. I wanted to let her know that that gesture did not go unnoticed, and I was so grateful that she was there for him. I didn't know then that that email would be the beginning of one of the most impactful relationships in my son's life, and that she would become the star of our team. She set the bar high. With the knowledge and experience that I have as a professional, often I find people will tell me that my son is lucky to have me as his mom. What they don't know is that I prefer to be the professional. I never imagined that I would have my own lived experience of raising a neurodiverse child. My son has had 2 incredible pediatricians, received treatment from several subspecialty teams, been trialed on countless medications, and been part of life-changing research. He has required extensive educational supports every year. And we work hard every day to be the kind of parents that he needs us to be. Communicating with all of those service providers and coordinating appointments, following through on their recommendations, putting that all together has been incredibly difficult. I have felt so frustrated over how each provider treats just one of his co-occurring conditions at a time, despite the reality that many of them impact each other. Until finally, years later, I chose to see this differently. I began to see that each provider had a unique role to play within our team due to the experience that they had. I also looked outside of his healthcare team to our broader community, where he had interactions with teachers, coaches, tutors, and so on. And I included all of them as members of this growing team. Your child's community is where their health and development happens, where it can be fostered and sustained. Think about who the touch points are in your community environment. Is your child part of a recreational activity where there's a coach that's there to support and cheer them on? Are you part of any faith-based organizations? What about that pharmacist that you see frequently because your child's on a variety of medications and you're constantly adjusting the dose? There are so many people that are going to or are part of your child's life, and they each do truly have an important role to play. Having a child with complex needs can be absolutely soul-crushing at times. Creating a team to walk alongside you is really important because you weren't meant to do this alone. This is what community is truly all about. What makes your child unique? Educate yourself first about the diagnoses that they've been given. Because when you've done that and have that information, you are then better able to educate others. There are similarities within the same diagnoses. However, I have never met two children with the same diagnoses who are truly the same in how they may respond to treatment, their developmental trajectory, the way they interpret the world and share, and so on. And as you're learning about your child's diagnoses, that often involves research. For some of us, we may have had opportunities to learn how to do that within our own, our education or our professional role. And for others who haven't had that opportunity, that can feel really daunting. Your local library is a great place to start. There are people there who would be more than happy to show you the ropes on how to research. You can also learn so much from attending conferences, webinars, workshops, something like this chat that we're having here today, listening to podcasts, joining parent Facebook groups, and so on. But certainly, you will find that you, without a doubt, learn the most from another family who has a similar lived experience. When my son was in grade 6, some of the school personnel let me know that there was another child within the school that also had Tourette syndrome, and they asked if I would be interested in being connected to the mother. And I absolutely was. The mother and I got together for coffee, and she was the first person I had ever spoken to who had a child with Tourette syndrome as well. And we laughed and we cried and shared stories and we spoke the same language. That was an incredible opportunity for me. The challenge when you are out there reading about your child's diagnosis and how you can help and finding information, you will also discover a lot of misinformation because it's just easily at our fingertips, especially within social media. And that can be really challenging to navigate. The thing is that if you follow misinformation, that can also potentially lead to poor outcomes for your child. And that's where I would really encourage you to maintain the relationships with the healthcare providers that you trust, because you can always go back to them and ask them about the information that you've heard or read about. They are the source of accurate information on health and science related to your child's care. And it's okay to ask questions, obtain second opinions, admit that you just don't understand. And sometimes I find what's hard is, as the mom, is that the emotions we have often block the learning or our ability to hear what other professionals are explaining to us. Because we work so hard at keeping that in check that sometimes the information shared with us just gets lost. So it's okay to ask for a copy of the provider's notes afterwards that you could perhaps bring home to review. Ask for something to be explained differently if you need that, or an example can really help. And there's been times when I have had people literally draw me a picture or a diagram to help me make sense of what they were telling me. So now, after you've done that, which it really is, that learning is never done. As your child grows and changes, the learning just is constant. And the information that you will receive about your child grows. And eventually you will have an overabundance of paperwork and emails and pamphlets and so on. So putting that all together, where do you start with all of those documents and emails? You just need to find what works for you. For some parents, that might be a binder with color-coded dividers or an accordion folder. Some people really like to use an electronic system to keep track of things, or an organizational app. For papers, what I suggest to people often is that it's important to make sure you're jotting down the dates on papers. I would suggest using a pencil because you often have to make copies of things to share with other people, and that allows you to erase if necessary. And emails. Never delete an email. There are countless examples I could give you about times I've had to go back to emails, and especially when something maybe hasn't been followed through on that we discussed, and it allows me to forward that email exchange on to that person I was communicating with and just send them a friendly reminder about them catching up or following through on what it was we had talked about. And with those emails, it can be really helpful to create a way that you can categorize them often by dates or by, the healthcare team emails and the community team and the school team. And you can save those onto a cloud or an external drive. So those are just a few tips that I've learned along the way. And I'll tell you what, there's going to be times in your life when the best you can do is put all of that information into one big box. I remember many years ago, that's where I was at when we were having a particularly challenging time. And I had gone into work and said to my colleague, oh my goodness, I would do anything for somebody just to show up at my house with a hole puncher and help me sit down and hole punch all of the documents I have and get them organized. And a few days later, there was a knock at my door, and there she was, hole punch in hand and ready to help me tackle that big job. Something I also just want to have you be mindful about is the importance of being, I guess, mindful about some of the emotions that come about when you are going through all of that information and seeing your child just written down in black and white. I remember when my daughter, who has very significant learning challenges, had a psychoeducational assessment done a few years ago. And after that information was shared with me, I was given a lengthy report. I put it in an envelope and couldn't even read it for several weeks. It's hard when you know that your child is more than a diagnosis, but it's important to remember that, and that what is written in the assessment is just things that you're going to use to help your child get their needs met. It might open the doors to funding, treatment options, and access to services. And you know what? It's okay to sit in the feelings of sadness and wishing that things were easier for your child. And once I've sort of allowed myself to feel that way, I move on and I use that emotion to fuel me, to find solutions, to find what is going to work best to meet my child's needs. Many years ago, I had a phone call from a mom who had just come back from the playground with her children. She told me that taking her son there and allowing him to use the swing was some of the best moments of the day. They were able to get outside, be in the fresh air. He was confined in the swing to one spot, so she wasn't busy trying to chase him around the house. And most importantly, he was happy. She told me that often she would try to go to the playground during periods when she knew it wasn't busy, so that he could swing for as long as he wanted. On this particular day, though, another child approached them, and the mom knew that that child was wanting to have his own turn on the swing. And she said, in that moment, she didn't know what to do, because if she were to take her son out of the swing, he would have an absolute meltdown, screaming, crying, throwing himself down on the ground, and then she would be left feeling judged by the other parents that were around, and knew that people wouldn't see her son and know that he had a significant neurological deficit. So she said to me, I wished then that I had a sign that I could just hold up to explain why my child was the way he is, and why he just needed to be allowed to swing as long as he wanted, and to please not have judgment. That's the challenge with diagnoses and things that might make our children different. They're not always easily recognized. The public's ability to understand your child's differences, how to interact with him or her, is impacted on a variety of things, such as their own personal experience, their education, exposure or the lack thereof to the population, their biases, and so on. And this is where storytelling comes in. There is incredible value in sharing your story with providers and the public. This allows others to understand where your child and family are coming from, what your journey has been, and how your child is impacted by their diagnosis. And how you share that information, what parts of it you share, and when you share it is all up to you. Jodie Carrington is a psychologist that lives here in Alberta, and you'll often hear her saying, empathy lies in the space before judgment. As you share your story with others, you'll find that there is a pause while the person listening is reflecting on what they did not know. Empathy lies in that pause. People are less likely to form judgment when they have a better understanding of where you are coming from. And that leads us to educating others. Storytelling is part of that. Make it your mission for everyone to know what makes your child special and who they are as a person, over and above their diagnoses. This includes your healthcare team, people that you're interacting with in the community, those that might be supporting your child in the home, family members, friends, and neighbors. What you'll see here is an example. This is a fictitious patient, but I just created this. I call it a one-pager. There are lots of suggestions on how to do this online. And I have found this to be a really effective way to have a snapshot of a child that can be captured in a very strength-based way. All those documents I was talking about just a couple of minutes ago is just overwhelming. And often, you're sharing all of that information with other people. And the reality is people aren't able to read all of that necessarily and make sense of it all prior to having an interaction with you. And so you can put together the real key pieces in something such as this one pager. I used a program called Canva to create this. You can register and use it for free to do something like this. There's also other programs as well, such as Visme or Creative Cloud Express, just to name a few. Often when I go to appointments or meetings, I find that there's often a focus on the child's challenges. And time again, I have left appointments and realized that I didn't say one positive thing about my child. We need to make sure that providers create space for that to happen. And it's okay for you as the parent to say that you'd really like to start the meeting with what is going well for your child. The one thing I really want to point out about the one pager is that on there you'll see there's a little piece about what this child loves. I think that is more important than anything else. And the reason for that is that then the adult who's going to be interacting with your child will know something about what your child's interests are and what they're maybe good at or really like and love. And that creates an instant connection. More than once, I have asked teachers just to take a few minutes alone with my son to talk to him about mountain biking, for example, or remote control car racing, because I know those are things that he loves. And that if they take the time to do that, they're in. He feels connected and the development of a relationship has begun. Be seen. I cannot emphasize enough how important it is to acknowledge those who are supporting you and your child and make sure that they know they're appreciated. I start every email, the beginning of all meetings and appointments, with acknowledging the special role that that particular person plays on my child's team, and that I am grateful for their knowledge and support. Again, Dr. Jody Carrington says, when they're acknowledged, they will rise. And that's the reality. When people feel that you really value what they have to offer and what they're doing for your child, they want to do better. At the clinic I've worked in for several years, we used to have this mom who had 3 children with significant challenges. And whenever she came to an appointment, she would always have a cup of coffee in hand for the nurse that she worked with the most frequently. That was several years ago. And I'll tell you what, we have never forgotten that mom and often talk about how on earth she ever had the time to coordinate that and get to the appointment. A cup of coffee goes a long way, but it doesn't have to be that. An email saying thank you, a little note, hand-drawn pictures by your children. Those are my favorite. And volunteering. This perhaps is more for sort of a school type environment, but I have found that having opportunities to volunteer on field trips, perhaps be part of parent council meetings and things like that, has given me an opportunity to connect with other parents and the other professionals that work within the school. And it allows me to stand out as the mom of this child who has extra needs, but they get to know me as who I am as a person. And I have found that allows you to be on the inside. And then advocacy somehow can be a little bit easier. Before the first day of school, I always ask for a tour to be provided to myself and my son. This gives us an opportunity to have him see his classrooms, meet the teachers, and we don't stop there. I want him, as much as possible, to meet all the people that are going to be part of his day. That includes the people that work in the front office, the caretakers, the librarian, and others. Because when my child's walking in the hallway, I want them to know who he is. That allows a quick connection, a hello that just suddenly provides him with a sense of belonging. As well, it's another way that as a family, you can show the appreciation that you have for how all of those people are coming together to impact your child, because your child is spending more time at school during the day than they are at home. A roar can be heard up to 8 kilometers away. You don't just hear it, you feel it. Every roar is unique. Your voice is the most powerful tool you have to express your views, experiences, and concerns related to your child. So let's talk about how you can design your roar with intention. In my professional role, I often act as a support person for families during healthcare appointments or educational conferences and things like that. And before we go into any of those appointments, I try to meet with the family ahead of time. Because despite how many times families have had these experiences, they're hard. And we need to pause and acknowledge that. There's a lot of emotions that come up when you're talking about your child and their challenges. I try to coach my parents to truly take a deep breath. Let your mane settle, so to speak. I remind them to drop their shoulders. If you don't have someone like myself that's able to be a support person for you, I really encourage you to bring someone else. Again, remember, you're not meant to do this alone. Your partner, an ally, a grandparent, a friend, or a neighbor, just another person to support you. And when you start into a meeting, if you are going in there with this concept that being a good advocate means that you are in for a fight, then you've lost the plot. You're creating a mindset that the people in the room are on the opposing team. And you need to keep in mind that everyone has the best interests of your child at heart, and you are setting an example. You are the leader or the coach of your team. Respect should be the center of everything you say and do. When you do have these meetings, often there might be multiple people involved. And it's really important that you have an opportunity to find out what role do each of those people play in your child's life, what's their position, and ask for their names and contact information. And when you have that, I would bring that one step further. I find that often parents might be given names and contact information, but then it's not clear to them who they would call or email for certain reasons. And that is a really important thing to make sense of and have an understanding about what the expectation is in terms of them getting back to you. A day, 2 days, 3 business days, what can you expect? Just so that you know and you're prepared. And when you do go into a meeting or an appointment, if you've had an opportunity to get prepared ahead of time, that can be really helpful. That might include just a few rough notes that you've jotted down, or using your cell phone to make a little list in your notes there. And the reason you want to do that is you want to make sure that you can be clear about the concerns that you have and provide perhaps some evidence and some examples that support your view. And you really want to be open to hearing others' perspective. And you know what? It's okay if you disagree with what they have to say or they have different opinions. But it's important to do that without alienating others. Once there's been some solutions or strategies that have been talked about, it's imperative to have someone identified as the person that's going to take that to the next step. Follow through with it and make it happen. Have a really clear plan when you leave about who is responsible for what. And remember, if your roar is too loud, the volume is all that will be remembered and your message will be lost. You control the design. When you are going into a meeting or a conference and the idea is that you are hoping you can advocate for something to be different or change for your child, it can be so helpful to understand the limitations of the system and of the people that are going to be present for that. Who has the authority to make the decisions? An organizational chart is a great way to find that out, and often very easy to find online. In Alberta here, how it works in the education system is that a child is given a coding based on their diagnoses. And the more severe that coding is, the more money the school gets to support your child. I didn't realize how that worked for a long time until it was explained to me that my particular child, his coding fell in the severe physical and medical diagnosis range, which meant that there was no coding that was higher than his. So the school was receiving the maximum amount of funding to have him there, but that it would take 6 children with such a diagnosis to help pay for one educational assistant. Understanding that, realizing there was a limitation there, really opened my eyes to the reality of what I could ask for. And always know what the plan is if things don't maybe go according to plan, because that's just the reality when we're trying to advocate. And sometimes you just don't feel like your voice is being heard. So what I like to do ahead of time is know what the complaint process is, who I can talk to next, and I keep all of that information just in my back pocket in case I need to pull it out. Early on in my journey, I thought that advocating for my child meant that I was gearing up for a fight. I thought that if I was loud enough demanding enough, and mad enough, I would get exactly what I thought my child needed and deserves. Through my own experiences and while supporting other families with advocacy for their children, I started to recognize that there is a delicate balance between the relationships that I'm trying to cultivate and advocating for the child. When we are intentional about our communication, relationships thrive and a beautiful team comes together to support our child. When I communicate, I try to be mindful of the strong team I am creating around my child and family. I'd like to tell you about an example of a story where this worked recently. I was working with a mom who was very capable of advocating for her child, but really felt like her voice wasn't being heard in his school program. Her son had a complex medical and developmental profile, and she was receiving frequent communication from the school around his behavior and other challenges that they weren't sure how to manage. And the language they were choosing to use to describe that child really didn't sit right with the mom. She reached out to me for some support. And I talked to her about the possibility of creating a case conference and we would include as many people as possible to be there. This is when it's important to think about who's around the table. I wanted the principal, the teacher, the educational assistants, and any other allied health staff involved to be there. The mom and I worked together to prepare an agenda and one of those one-pagers that I showed you a few minutes ago. I showed the mom how to create one. She got busy and made the most beautiful one-pager that even included a picture of this child's MRI to show the significant brain changes that he has. The nice thing about that one pager, I find, is that it allows a kind of the mom to have a focus, a place to start when emotions are high. And that's what worked well that day. And I'll tell you what, as the mom and I spoke, you could see the physical shift in their posture. Everyone started to relax. They leaned in and they asked questions. We made sure to acknowledge them at the beginning of the meeting and used the word team, and that we were creating a team for this child, that he had an amazing healthcare team looking after that end of things. There were people within his home environment supporting him, and he was connected to multiple recreational opportunities in the community as well. And that we wanted the school to be part of that, and we really appreciated their time and effort with him. Everyone got really involved in the discussion. We talked about solutions. We listened to everyone's input. They became invested in this child because we had created understanding and empathy. When we left the meeting that day, the mother said to me, "I can tell you right now, this is going to be the best day of 2024 because she had felt so good about how that had gone." And just last week, I received an email from a school team member who had been in the classroom, who hadn't seen him for about 3 weeks. And she said, "This was the first time I was back in the class since you had that meeting. And I want you to know that he was happy, participating. The interaction between him and the school team had completely changed. the mom responded to let me and this particular person know that she had also noticed that change at home. He was getting off the bus at the end of the day, happy again, and he hadn't been all fall. In fact, it was starting to get really hard for her to get him to even want to go to school. But now, the mom said that on the weekends, he's always asking whether or not it's a school day because he can't wait to get back. And that is the power of creating partnerships and understanding and empathy so that other people can meet us where we're at. We can educate them about who our child is, what they're all about, and we can work together for our child to be the very best that they can be. Thank you very much for your time today.
Oh my goodness, Karen, thank you. What a fantastic presentation. There's so much in there, and you've had just so many people glued to your presentation watching. It's fantastic. One thing, well, first I'd like to remind everyone who is watching, feel free if you have questions or comments, you can put them in the comments right now, and we will respond to them and take your thoughts. But I wanted to share just how powerful that idea of the one pager is. I love it. I think the whole world, we should all walk around with one pagers of ourselves.
Yeah, right.
And I was wondering, thinking that way, have you ever done the same kind of like with the team? And what if the team put together their one pagers, or you were mentioning, having trouble sometimes remembering, who falls under what, who do you go to for help for certain things, and how helpful it could be to create your own little one pager of the various people you have to deal with, and grab their picture from LinkedIn and their title and their contact information, so that because there's so much information and so much overwhelm for parents, and even those who, like yourself, are used to dealing with the world of healthcare and providers. When it's your own child, it's a whole different experience.
Yes. Yeah, absolutely. Yeah. So Jenna, this idea of the one pager has sort of been something that I've sort of started doing a little bit more recently, and to date have only been doing it sort of with parents, and sometimes the child has sort of given us some input as well. But I think that's a great idea. That certainly you could do that sort of with the team as well and get some of their input. I think that's fabulous idea. And your comment around sort of keeping track of who's who and a list of that, I'll have to tell you, that's a big part of actually what I do, because often I find when I'm, connecting with families and trying to make sense of who's who within the community and the health team and whatnot, it's a lot. And parents will be there with their cell phones scrolling through, trying to like find all the contact information and provide it to me. And I'll just say, would you like that information just like all in one place? And they're just like, are you kidding? Absolutely. And it can be a bit of a time consuming thing to kind of pull that all together. But I think the value of it in the end is, it can really be really very helpful. And sometimes there tends to be maybe one parent that takes on the role of the organizing and the contact more than the other. And if there's a time, right, when all of a sudden the other parent maybe needs to start doing a little bit more of that, I think then too, it allows them to know who to get in touch with.
It's funny you bring up that point too. I made a note when you were talking about the, encouraging people that, it's okay to, ask someone at the end of the meeting, can I have those notes, or can I have some of, something to take away, because I was so caught up in just trying to take in the information. And, a tip that I would share, because I know a lot of people sometimes would feel awkward asking for it. They think it's going to make them look bad as a parent, that they couldn't take it all in, which is definitely not the case. But we have those voices in our heads,
Yeah.
right?
Yeah, you bet.
But you just pass the buck and say, my partner couldn't make it. Do you have some notes I could take to them? Like, make up a person if you need to
Yeah,
say
right.
that you need to get this information for. So if that's what it takes for you to ask for it.
Isn't that right? Absolutely, Jen. And I would add to that that sometimes, depending who you ask for things like the copy of someone's notes, there's sometimes limitations in their ability to provide that to you without the sort of writer's
Mm.
permission. But you can always get your way there. So it's just sort of, making sure that you can acknowledge that they might need to ask that person for their permission, but you would really like that information when it's possible. Yeah.
Yeah. I just wanted to share one of the comments that came in there, just thanking you for the emotion and the information that you shared in this presentation. It's really powerful, and I think the idea that you can talk from both sides as both a professional and as a parent is really resonating with people. So thank you for sharing that.
Yeah. Oh, absolutely.
If anyone else has any questions for Karen, you can drop them in the comments now, or feel free to share it after we're done. We always kind of come back and keep an eye on the comments and the questions that are left there. One other thing that I wanted to just kind of touch on, you were talking about the idea of just finding the star on your team, and
Mhm.
really kind of you know letting that person know how important their role is. And I just I wonder if you can share any tips and ideas if someone's kind of still trying to find that person within their
Mhm.
world.
Right, right. Yeah, I think it is something that just happens when it happens. There's so many connections and interactions that you'll have with your child. And it's not realistic to think that you are going to connect with all of those people. And there might be times when you wish they didn't have to be part of the team, but and they don't necessarily need to be. So I think this is the other important thing to recognize, is that we do have some control in who is part of our team and what role they play. And so that's an important thing to keep in mind too. And I have found that those particular people that have really stuck out in our experience, it has just happened because there has been some type of extra connection that we've, perhaps maybe we kind of fueled that connection a little bit by our communication or interaction with that person. But that just for some reason, myself or my child also felt that too. And it makes me think of an example where my son was part of a research study for a long period of time. And he got to know a couple of the gals who were leading it really very well, because we were spending hours at the hospital every day. And by the end of it, even though he had been through a lot, he didn't want it to end, because he really, really valued the interactions with them, because they just got him and just accepted him as who he was. And I think he really felt that the time they were spending with him, they were invested in helping him and his challenges be less. And then a couple of years later, for his birthday, that's what he wanted, a video chat with those two individuals. And so I set that up, and that's it was just adorable. So yeah.
Oh, that's so fabulous. I know it was one of the real points that our neonatologist kind of drove home when we were in the NICU. He very much made a point of letting us know how much the nurses and the doctors appreciated when you come for your follow-ups. Don't just come down to the pediatric side. You come back up here and wave through the window at least. And we did. We always made a point of going in and stopping to visit and show the growth. And sometimes it's hard for parents to do that sometimes, but it's so important.
Oh, absolutely. And as a healthcare person, I have to tell you that I think we appreciate that so much, because all the little people that come in that you interact with, they always stay in your mind and heart, right? And you do sort of wonder about where they're at and how things are going for them. And so I think that's really special that you take the time to do that. Yeah.
Well, thank you for taking the time to be with us today. We're going to to say our goodbyes now, but thank you so much for this presentation, Karen.
Absolutely. You're welcome. Thank you very much for having me, and have a great weekend.
Thank you. And I'll take a moment to thank all of you for joining us today and for taking part in the comments and sharing your thoughts. We really appreciate you spending time with us. That was my guest, Karen Taylor, who's a care coordinator with Alberta Children's Hospital. You can watch this presentation again. It's on our YouTube, it's on our Facebook, it'll be on our website, which again, if you're looking to find us, it's canadianpreemies.org. I'd also like to take a moment to thank our sponsor for this series, AstraZeneca, for their ongoing support of our educational programs. As I mentioned, Preemie Chats is here each Friday at 1 o'clock Eastern Time. We hope that you'll be able to join us next week. Have a wonderful weekend.